Dental practices in England have been able to reopen today as long as they have safety measures in place for staff and patients. But the British Dental Association says few practices have actually opened their doors, and those that have are only able to offer a fraction of their usual services. In Scotland, only private dental practices can open. In Northern Ireland, official advice is for urgent patients to be treated from today. In Wales, routine services are set to resume on the 1st of July. Dan Johnson has more.
The calls have come for weeks.
Good morning, Together Dental.
From people in pain.
Is it a constant pain or does it come and go?
The staff are here.
Is the pain in the top, bottom, left or right of your mouth?
But most patients still can't get seen.
We're only seeing severe emergencies.
We have to leave an hour between appointment times. The other element is the PPE. So just to give you an idea, we would usually see 160 to 200 patients a day in this practice. We're only going to be seeing a handful of patients.
Patients like Suzanne turning up at the door have been turned away to treat themselves at home.
I've been suffering toothache for quite a few weeks. I contacted the dentist to try and get an appointment for this week, but unfortunately I'm not able to, even though they're open.
And if you can get an appointment, this is what you'll see. More protective clothing changed more often, and more cleaning means extra cost and delay.
Mrs. Charlie, please.
And up the road in Chelmsford, here's the new open-air waiting room. Patients are called in one by one.
We weren't sure, were we, when we phoned up this morning if they would see her, because they say, oh, it's only emergencies, but we're quite surprised.
This practice stayed open as one of the few emergency care centres.
We've had patients in the early days coming from Edinburgh and coming from Hull. Now, hopefully, with more practices opening, they're going to be able to access their own dentist. And we have already seen a drop-off.
Because it's nothing like business as usual yet?
Oh, no. It's not like a light switch which you can flick it on and flick it off. This is going to be a long, long process.
Getting this emergency system up and running took a long time and left a lot of people frustrated. And now dentists are struggling to fully reopen. And if patient numbers are never going to get back to their previous capacity, that raises some serious questions about the future of some practices.
Many of my colleagues are going to struggle financially unless some security is there for them over a longer period of time until we get back to seeing routine treatments in a more general way.
We're told more protective equipment is coming, but only a third of England's practices say they can see patients. Access wasn't good before, and it isn't getting any easier. Dan Johnson, BBC News, Essex.